here with Dr. Julia Carroll, one of our favorite guests, dermatologist, talking about skincare during pregnancy and post-pregnancy.
Yeah.
I was wondering why they did this one-on-one
right.
with you and me, and I have to show you because this is one of the first topics that we're talking about. Can we just zoom in on my hair, because this has been a topic of this has been a problem topic for us here.
So you've got these
right here,
short
I've got
little hairs.
these short little hairs,
right?
And it just happened after I came back from mat leave, and there's people are constantly chasing me with hairspray.
Because you've got the little sprouts everywhere.
Exactly.
Right.
And because I have a full head of hair, I didn't think I lost any hair.
Right.
And then all of a sudden I thought, why do I have bangs?
So when you're pregnant, so everyone loses about 100 hairs a day, but when you're pregnant, you don't lose it. So you may have noticed that you had amazing hair when you were pregnant. And one of the sort of inspirations for this segment was we've got the royal baby coming.
Yeah.
We were sort of inspired by Kate.
Okay,
and
so it wasn't me and my problem
you
hair.
as well, of course. But you know, she has gorgeous hair all the time. But when you're pregnant, you know, it's even better. So that's the good news. But the bad news is within 6 to 12 months of having a baby, you'll start to see that hair go.
Especially if you're breastfeeding, after you stop breastfeeding.
Absolutely. So a couple of things. Don't panic. It's very, very normal. But there are a few things that you can do. So I brought a few examples.
Give it to me. I'm putting it in my bag.
So we have, this is called Viviscal, and you can get that supplement in the drugstore, and it's not a vitamin, but it's sort of a marine plant and a marine animal kind of extract, and they actually have really good studies that it does help hair growth for women.
Okay.
And then these are pregnancy vitamins, and they're really great. So they help keep your hair great when you are pregnant, but there's no reason you can't keep taking them afterwards.
Yeah, okay, I was going to say, and they're safe if you're breastfeeding?
Yes.
Okay,
yeah,
wonderful.
Yeah, and then if you're going to get pregnant again, it's good to be on them already.
All right, I could talk about this for the entire segment, but let's move on to other things.
So the other thing is melasma. So it's called the mask of pregnancy. You see it on the forehead, around the eyes. It's a brown, dark discoloration. So it's a combination of estrogen and sun. Yeah. So where do we get estrogen from? You can get it from the birth control pill. So you say, okay, fine, I'm not going to do that. But then, oops, you get pregnant, and you can get it from pregnancy as well. Okay. So you kind of can't win on that front. But there's a couple things you can do. So this is going to be your best friend. So you're gonna want to wear a hat the entire time. So someone like Molly Sims, the beach babe, she was very, very careful in the sun while she was pregnant.
I guess this is the upside of the only upside of the weather right now is you don't have to do this. So just really protect your face from the sun.
And of course sunscreen. Yeah. We're always going to be wearing our sunscreen. And if you do get a bit of the pregnancy mask, there are products you can get that have hydroquinone in them. And then the latest treatment for it is the Cyton Halo laser, and we have some pictures, I think, of melasma and the before and afters. And so you can see this woman, she had melasma, and then she had the treatment and significantly better. She's still going to have to protect herself, but for me, that's an amazing result. And this is new technology, the Cyton hybrid laser. It's amazing.
Oh, wow, what a difference. And tell me about mom hands.
Mom hands. Okay, so really quick, I want you to try this cream out for me. So when you're off on mat leave, you know, a lot of people who are like you, working women, and then all of a sudden you're home for a year, and what are you doing? Your dishes, diapers.
And you're constantly washing your hands because you're paranoid about getting your baby sick.
So then people come into my office and they've got their stroller and they say, I don't know what's wrong with my hands. And I'll just say, well, when did you have your baby? So you get cracked hands, eczema. But the thing is, what you want to do is not just treat your hands when you get the eczema, but think of a cream like this this product here, the CeraVe Therapeutic Cream, as your glove. So I'm going to put a little water on. I don't know if we're going to be able to narrow in on this or not, but you can see it just beads right off your hand. I'm not sure if we can get a shot of that or not. So we can, and the water's just
trust us, it's happening. It's happening.
It's just beating off. It's not getting in there, it's just beating right off.
Okay, and that's the result of the cream.
Yeah, that's the sign of a good hand cream, so we're using the cream as our glove.
Amazing. So for all of the mat leave moms watching right now, thank you so much. I felt like that was like a one-on-one session for me. Dr. Julia Carroll, dermatologist, thank you so much for giving us all these tips.
Great.